welcome back. This is Casey. I have a beautiful, beautiful person to introduce you to. She is Teresa Sanderson. I am going to bring her in. Let me get both of us on the screen
Hello,
here.
hello,
There we go. There we go.
hello,
Technology.
hello.
Welcome, welcome. So I am this is a long overdue interview with you, and it's actually perfect timing. So first of all, I wanted to introduce the community to who you are. You are a nurse at heart through and through,
Yep.
but you have been engaged in so many different entrepreneurial activities and adventures. So I just wanted if you can just share a little bit of yourself with us. Your
Well, sure, sure. So, and thank you for the opportunity, Casey. I so appreciate you and just your friendship and collaboration. I love that. I've been an RN for gosh more than 30 years, and in that time, I'm an associate degree RN. That's also something that I like to share because I think many nurses hold themselves back in entrepreneurship and other things in nursing thinking that, well, I don't have enough education or that kind of thing. So I want to encourage any nurse who considers entrepreneurship, no matter what your educational level, that it could be a possibility for you. So like you said, that's a big part of who I am. Other than that, I am a wife. I'm a mother to five. You can see I enjoy the outdoors. I love camping. And I love nursing and I love nurses. And I believe that nurses have suffered for far too long with the concept that nurses eat their young. And so I just feel like, from a personal perspective, this is my passion project. This is my mission right now, is to transform nursing culture from a culture where nurses eat their young to one where nurses feed their young.
Absolutely, absolutely. So, give us a little background before we get into nurses feed their young. Give us a little background. You said you had you were an associate degree nurse, but you actually ran a couple companies. Did you? I think you ran a hospice company. Did I remember
For sure.
correctly?
Yeah. Yeah. And you did. You did. And, it was an interesting thing. My husband was already an independent businessman.
Hmm.
So I would come home and lament about the kind of hospice nursing that the organization I was working for was doing. It was just felt like it was what I call lukewarm, kind of half in, half out,
Hmm.
and not really committed to the task of really ministering to the dying and their families. And so I would come home and say, I can't believe we're doing this way, that way. And Greg would always say, you just need to start your own. And I would say, oh, you're just crazy. You have no idea what that's like. You don't even know what that would look like. But this continued this way for probably months, until finally I just thought I at least should look into it. He keeps saying it. I should at least explore. And lo and behold, I found that I could actually open a hospice. And so step by step and layer by layer, I unraveled the application process and just literally, I was very deeply in prayer at the time. And so every step that I took, yeah, I truly felt guided during that
Hmm.
time. And any obstacle or barrier that I encountered was just eliminated. Somehow it was removed from the path. And so I just felt like it was definitely intended that we open the hospice. And I have to tell you, that was one of the most fulfilling, most life-giving experiences of my life, was to be able to serve so many patients and families, many, many more than I ever dreamed of, but also in a patient-centered way, with nursing responsible for the budget, nursing responsible for the outcomes. It was a beautiful, beautiful experience.
Wow. So I want to zone in on you said that you were complaining,
Mhm.
and it really was in your husband to tell you this is where you should actually run it. And I want to point that out because there's a lot of nurses and they're really not liking things, and it's easy to
Yeah.
get into complaining, but I actually see that complaining being that's actually your mission. That's your calling to right the wrong.
I love that. Yeah, exactly. And so we can stew in the complaining
Mhm.
or we can step up. And
Yeah.
so, yeah, it was truly on me at that time to just step up, step out, and we became the predominant hospice in our area because of the passion we brought to the table. That's the thing. When you love what you do as a nurse, we were able to impact hospice length of stay, Casey. It was 3 days. 3 days was what most people got in hospice. So automatically the community assumes as soon as you start hospice, you die,
You
right? I
die.
mean, that's what it looks like. And
Mhm.
so a big part of our mission was just let's increase access to care. Let's do a lot of teaching of the healthcare community. Let's do a lot of teaching and community engagement so the community knows what this is about and how it's
Mhm.
paid for. And by the time we sold 10 years later, we had increased median length of stay to 21 days. And that to me
Wow.
is a positive outcome, right? That's a measurable positive outcome.
Yes, that's absolutely incredible. You see why I wanted her on? She is phenomenal. She is phenomenal. And so now you're so as part what I see as part, because I was going to ask you what you wanted your nursing legacy to be, but this project that you are taking on, I really see it being the epitome of your legacy. Would you mind sharing a little bit about what the project is?
Oh gosh, I am truly honored. Thank you. Thank you very much for the opportunity. So, nurses feed their young. Casey mentioned earlier that I have rebranded. Last year, up to last year, my company was known as just simply Teresa Sanderson Company. But I've always been a servant, right? I've always been a servant, a helper. That's always been my role in life. And so I have rebranded to Nurses Feed Their Young. Everything that I do in business is going to work under that brand. And we have a primary mission of transforming nursing culture, right? To a culture from nurses eating their young to a culture where we embrace and feed our young. We have three pillars that we really believe in. One is cultivating nursing leaders, the second is innovating nursing continuing education, and the third is developing nurse entrepreneurs. And there are some very specific reasons why each of those are important. But we can dive into that, when and if you're ready, Casey.
Yeah. No, I think it's beautiful and I love the three pillars because it moves so in sync with nurses in charge and all the other nursing movements happening. It's
Mhm,
as though we're all moving to the same beat, but it's such a big project. We're all taking different aspects of it.
mhm.
So for Nurses Feed Their Young, this brand, is it just limited to nurses in the United States or is it for nurses all around the world?
It is truly for nurses all around the world. And what I found, it's been about 2 years now that I first exposed our logo and posted it online and started talking about it. And I immediately got messages and feedback from nurses in the UK, in the
Mm.
Bahamas, in, the Middle East, India. So the funny thing is that nurse, and we all know that nurse who eats his or her young, that nurse
Yeah.
exists everywhere in nursing around the world, and that
Mhm.
is just such a phenomena in and of itself, right? But, so
Mhm.
the movement is global. The movement is
Mhm.
global. There are no limits on this mission because nurses everywhere need to feel supported, valued, appreciated, and we should at least be able to come to the table and take care of our own.
Absolutely, absolutely. And your timing is impeccable because here in the US, we're facing where there's a big shortage of experienced nurses saying no more, we can't do this anymore. So you
Right.
have a lot of new nurses and they need that mentorship. They need someone to feed and pour into them. So how is
Mhm.
this community gonna look in terms of helping students, helping new nurses? How will they be able to interact and engage in your community?
I love that. Oh my gosh, such a great question. So I'm going to talk about the three pillars. I think this is a good place to just add that info. So cultivating leaders. I think we all have seen in nursing that many times you are placed in leadership. A nurse may be placed in leadership just because you've been there the longest. And
Mhm.
today that may be a week, 3 months, 6 months,
Yeah.
and it's happened. It's happened to me, Casey. I'm sure it's happened to you. that all of a sudden, poof, you're just in charge and you're now the leader or the unit manager or the charge nurse with no additional training. Okay. So this is an issue. And so Nurses Feed Their Young, we value cultivating nursing leaders, but we also believe this should begin in nursing school curriculum. I'm going to say that
Mm.
out loud and bold right here
Say it
because
bold. Say it bold. Say it bold.
nurses need to be prepared to come to the table and communicate with emotional intelligence. We
Ooh.
are not showing up this way right now as a rule. There are a few seasoned nurses who are skilled in emotional intelligence and maybe personality science and understand the mechanics of the emotions and how that has play. But how can we put a nurse in a leadership role and not give them any leadership training? This is a fault. I mean, we've all said healthcare is broken. Well, it's broken in many different ways, and this is one of them. And I consider this, and another thing I say loudly, is this is the most epic leadership fail because we were talking about this nurses eating their young when I experienced it for the first time more than 30 years ago when I was in nursing school. Okay. So this has been around for decades. It's not anything new, but what's happened now with the stress on nurses since the pandemic is that nurses are even more prone to being irritable. They're more prone to eating their young. Why? Because of chronic staffing that's not just existed since the pandemic, short staffing, it's existed for decades. It's existed for decades. And so nurses are tired. The seasoned nurses are tired. They've been waiting a long time for those new grad nurses to show up, right? A long time for new nurses to come in the door. And they don't have the patience that they might have had. And who can fault them, right? They're exhausted. They felt undervalued, unappreciated all this time. You know, there's so much that goes into this. But anywho, we need to start developing leaders in nursing school curriculum, at least giving them the base knowledge about communication, emotional intelligence, so that we can communicate with influence. A leader without influence, that's like a farmer without a plow. You can't get the job done without
Yeah.
influence. So our leaders need to be trained in influential communication and how to motivate their teams. They need to understand that each member of the team is motivated by something different. So that's cultivating nursing leaders. The second piece is innovating nursing continuing education. As you said, Casey, we have a lot of seasoned nurses who are tired. They are tired. They've been in the trenches for a long time. And, as you know, just like I was saying, they've been waiting for the new nurses to show up. Yet when the new nurses show up, the veteran nurses now have the task of
Oh, we lost her. Okay, and we're back. Okay, we're talking about leadership.
yes. And yeah, talking about the challenges specifically of, with as related to what Nurses Feed Their Young would like to do with innovating nursing continuing education. Okay. So new nurses graduate, the seasoned nurses are tired. They've been waiting for them to show up on their units, right? And are very excited to have new nurses, but then they get tasked with precepting new nurses. And so this adds to the workload and can also be frustrating for the preceptor because many times they have the same patient load while they're precepting a new nurse and also responsible for the safe practice of the new nurse in this environment. So in my opinion, this is a great way for us to begin to innovate nursing continuing education by creating specific training programs, unit-specific training programs that can be developed by those preceptors who stand out on the units so they can hand down their knowledge and expertise in a different way to these new grad nurses so that they can get started. It saves everybody time. It allows the precepting nurse to what? Feel valued because I'm asked to prepare this content. And then it also saves a lot of time for both the preceptor and the new nurse. The new nurse can feel more confident because I've seen some training curriculum. Now I can handle these basic functions on the unit. I know what to ask my preceptor if something doesn't look or feel right. And then they can take that learning experience that might have happened through a recorded training and find a real time learning experience on the unit to
Mhm.
follow through, right? So there are
Mhm.
so many things, but we have to begin to look at nursing differently. The way we've always done it is not going to carry us into the future. The way we've always done it got us where we are right now.
Yes, in a mess. It really
Yes.
has. It really has. And you are speaking to the choir. And the last pillar, what you're going to talk about entrepreneurship, I think it's so important because a lot of nurses have no business skills. And I'm talking as a nurse who did not have business. I didn't even know how much medication cost in the hospital. Like I didn't know
Yep.
the price to the patient. I had
Yeah.
no financial understanding when it came to healthcare.
Yes. Yeah. And so I think this is such a unique point. And I've heard from other people, I've talked, about the movement with other nursing leaders, and some have said, you should leave the developing entrepreneurs piece out of what you do. And no, I really can't do that because for me as a nurse, my personal experience is after we owned our hospice for 10 years and sold it, I experienced major depression, true clinical depression, and couldn't work for 3 years. I had opened an application for disability because I didn't see that I would ever be able to return to work as a nurse. Now, 3 hard, long years later, after doing a lot of talk therapy, a lot of medication, oh my gosh, just a lot of lifestyle changes and truly integrating self care, not
Mhm,
just as a word, but as a practice and ritual in my life,
mhm,
was able to come out on the other side. Okay. So I've been able to go back to the bedside and work at, major hospitals in our Kansas City metropolitan area, but it's not in my best interest to do that.
mhm,
And yet I
mhm,
have on my heart a great desire to serve nurses in a different way. So I
mhm,
believe there are probably thousands of nurses just like me who need
mhm,
an opportunity to serve nursing in a different way. And
mhm.
so entrepreneurs, we are not a threat to organizations. Help and support. We don't require the benefit burden cost. We don't require you to give us an office or anything like that. Let us serve in a different way through the experience and the unique skill sets that we have and the ideas that we have that can bring about change for the better. So I am very, very passionate about nurse entrepreneurship and helping nurses gain their foothold in that space because this is how healthcare delivery can change. In
Mhm.
the in the just by looking at concierge nursing, for example, what a difference in quality of care those patients can experience. Right, there are so many ways that
Mhm.
healthcare can be delivered differently that would bring the nurses who are licensed back to the workforce, but maybe
Yes.
in a different way.
Yes, yes, absolutely. I'm right there with you. And the
Mhm.
process, I've seen so many nurses step out and try, myself being one, many different forms, and you meet this resistance
Yeah.
from other healthcare facilities. And then you start thinking, maybe I don't have the value, or maybe my insight is not as valuable as I think it is. But
Yes.
realizing that there are gatekeepers, and then there's also things that you don't know when it comes to business, or you just have to learn and develop. It's not an easy road to entrepreneurship, but it is necessary.
I agree. I agree with that wholeheartedly. And, now, whether nurses are ready or not, whether the world is ready or not, healthcare is changing. It's changing right now under our feet. And so we are tasked to think about doing things in a different way. We're tasked to redefine what the nursing role looks like, how it's reimbursed, how it's
Mhm.
handled. And all of these things can be good things. Will it be somewhat painful? Absolutely. Absolutely.
Yeah.
It's always hard to let go of what has been, but at the same
Mm.
time, we have to be bold enough to step into the future for something better.
Absolutely, absolutely. So now, my I have two last questions here for you before I let you
Okay.
go. What
Okay.
role, as the as you're spearheading this movement of nurses feeding their young, what role do you think collaboration of nurses joining hands with other nurses is going to play in our progress and success as a profession?
Oh my gosh. What can we say about collaboration? I mean, it's just true. We are stronger together. We are stronger together. And when we have like-minded missions, just like yours and mine, Casey, the more we can partner, the more we can inter-refer, um,
Mhm.
the further we will reach, the faster we can gain momentum for positive change. And so I encourage collaboration. And for anyone in the entrepreneurial space or even in the organizational facility space, know that there is space in the world for success of all of us. This is not a competition. It's got to be collaboration. But the world is big enough for all of us to be successful. And if we can step forward in that kind of faith and trust and confidence, we can get where we need to be.
That's beautiful and so very true. I remember being in the hospital and they say when a doctor needs to call another doctor because it's not his area of specialty, that's
Yep.
like really like, wow, he's referring. But when a nurse
Yes.
doesn't know something and she has to ask someone, maybe call the other floor, you get the eye rolling like, how did you pass that class? We're so
Exactly.
each
Why
other.
do you not know? Yeah.
Yeah. So you are right about collaboration. We will get very far. And I see us all coming together. I see us being a different breed of nursing coming together and collaborating. So in the next 5 years, I think we'll be surprised what we all created together. But my last question for you, I'm gonna take myself out of the screen and I'm just gonna have you speak to the heart of new nurses or seasoned nurses, really encouraging them not to give up on this profession and actually really inspiring them from where you sit with your space and with your experience. So I'm gonna take myself out.
Okay. Well, first of all, what I would want to say to every nurse out there, whether you're a new nurse or a seasoned nurse, I would want to let you know that I see you and I value you. There is a place for each of us in nursing to serve and to be able to help. You went to school to become a registered nurse or an LPN or a nurse practitioner or DNP, whatever it is, with the intention of being able to help and serve other people. In the meantime, though, your own needs may have gone unnoticed by your employer. You might have been exhausted and experienced a lot of stress, maybe anxiety, some depression, poor sleep, just like me. Okay. So, first things first, take care of yourself. Okay. If you're experiencing anything, even if it is something as simple as not sleeping well, know that that's a symptom. I found that that was like the primary symptom I had when I crashed and burned from major depression. I also had a lot of anxiety, but the sleep was a huge thing. So, I want you to learn about your resources for taking care of yourself. If your organization has an EAP, you need to be accessing that. You need to be talking to your nursing leaders who can help you take care of yourself and support you in backing away from burnout and getting yourself well. The future of nursing needs you. The future of nursing needs me. It needs every single one of us. And so we are not complete without you. So I hope that you will stay in the fight. Please stand up and join the Nurses Feed Their Young movement. Get in touch with Casey at Nurses in Charge, and let's do something better for nursing.
Wow. That was incredibly powerful. Wow. Thank you so much. This was a beautiful interview, and I know you have a lot of projects going on, but you're just such an incredibly valuable person. And I met you in person, and you're just as lovable as you are, as your presence is online. And I just really appreciate all that you're doing, and I will forever remember you and this work that you're doing.
Thank you, Casey. Likewise. And I look forward to our continued collaboration.
Yes, ma'am. Yes, ma'am. So thank you for
Okay.
joining in. If you are part of the movement or you want to be part of the movement, Nurses Feed Their Young. Teresa Sanderson, she is very easy to find. LinkedIn, Facebook, her website, everything is very easy to find. And I'm gonna put the links below so you can have. Thank you so much for joining. Thank you,
Awesome.
Teresa. And we will close out
All
here. We'll
right.
see you next time.